Recently, it has come to my attention that mewing is back in fashion. Sort of. If you watched YouTube the last week or so, surely have stumbled across this ad of Andrew Huberman, who himself has garnered a lot of attention in recent times. While I have to say some stuff about Huberman, I will keep them for another video. What I can say right now is that if he is promoting this, he is promoting a scam. Mewing, which was a technique proposed by Dr. John Mew way back in the year 1985, was sold as a way for people to get a more attractive facial shape through the use of some pieces of gum that are hard to chew on and some techniques to restructure your facial bones. Well, regarding the gum, his whole theory was that it would stimulate the masseter muscles, which then in turn would theoretically change your facial shape to make you look prettier. Here's the thing though, mewing does not work. In fact, Mew's proposed ideas and research papers were rejected a total of 15 times. 15 times, yes, before they were finally being accepted for submission in a scientific magazine. Britain's General Dental Council has even stripped him of his dental license after multiple controversies regarding all of his orthotropic products. The whole thing with his mewing exercises is that while you can exercise your masseter muscle and make it bigger and stronger, that will not in any way, shape, or form alter the bones that it is attached to, which include the zygomatic bone and mandibula. This is not how things work. The muscle uses the bone as a handle, and while yes, it can exert some of its force on it, that won't be enough to bend the bone itself and change its overall shape. I mean, think about how impractical that would be for us humans if we could just bend our own bones by exerting some arbitrary amount of force. That would mean our bones are not that stable and not as tough to survive a dangerous fall, for example. Knew what he was doing all along. He targeted an insecurity many people have out there and tried to sell a product to cure the imperfection. In reality, though, there is nothing to his products. The gum that he is selling is pretty common in Greece to begin with, and it's no secret, and it's not a magical gum. Secondly, his whole theory that food today is too soft and that this causes problems with the jaw is far-fetching to say the least. What does softer food even mean? What is the difference between the food we eat now and like 100 years ago? This conversation is a bit pointless if you ask me. The rise in orthodontic related problems does not have to do with the food we eat, but with the fact that we now are able to diagnose more accurately things like malocclusion and other problems related to how the mouth is shaped and how that affects teeth and the jawline. Also, dental care is way more available to people throughout the world right now, and that is why, let's say, if someone has problem like an overreaching of the upper layer of teeth, now we can more easily diagnose this person, and we can diagnose this person in countries that before we could not, because there was no infrastructure, there was no good dental care in some countries. But okay, let's give Mr. Mew the benefit of the doubt and say that mewing does work. Even if it did work, it would have serious side effects, since moving your jawline around without changing the room the teeth have to fit in the mouth would cause other problems, which is kind of ironic because Dr. Mew himself claimed that things like overbite could be cured through mewing. Oh boy, if only it was that easy. We have yet another case of if it sounds too good to be true, that's because it's not true. If you actually want to have a more defined face shape with more edges, then I would just suggest you to lose fat. And by losing fat, I mean you should try to lose some weight. Losing weight will lead to losing body fat, which part of it is distributed on your cheeks, called buccal fat. This is an effective way for a lot of people out there to get a more attractive face, and it is way safer than the surgeries celebrities get, or the buccal fat is sucked out of their cheeks. In the case of the surgery, the body does not have the time to readjust its tissue composition and leads to that hollow-looking face that makes you look like Voldemort. But if I were you, I wouldn't stress about things like that. Ultimately, what determines our face shape is the bones that we were born with and our body fat percentage. So the only thing you can influence is your body fat percentage. In the case, however, that you might think that you have some kind of problem with your teeth, like an overbite or a malocclusion, you can talk with your dentist, who will, if he believes or she believes that there is some kind of problem, they will refer you to an orthodontist. There you can get treatment like braces or Invisaligns, which do actually work, but they do take some time and they can be expensive. But overall, in conclusion, there is only anecdotal evidence at best for mewing as an effective practice to make your face more attractive. As for the before and after pictures some people use, it's simply Photoshop in combination with good photography techniques and changing the angle of the picture you're taking. To the people that tried using mewing and believe it works, more power to you, but it is most likely a type of placebo effect. If you think that I'm incorrect, then I would love to hear your way of measuring the differences on your facial shape. In any case, I hope you like the video, like and subscribe for more. Goodbye.